Good morning. I'm Don Walker, and I'm the Communications Director for Brevard County Government. And we are here today for our biweekly update on the COVID-19 pandemic. On our panel today, we have Maria Stahl, who is the Administrator with the Florida Department of Health in Brevard. We have John Scott, who is the county's Emergency Management Director. We have Ian Golden, who is the Housing and Human Services Director. Matt Wallace, who is our Public Safety Director. And we also have Jesse Ray, who is our social media specialist, who will be monitoring your comments and questions on our Facebook Live event while we're giving our updates, and we will try to respond to those questions at the end of our updates. So as we always do, we will lead off with Maria Stahl for an update on the pandemic. Maria?
Hi, good morning, everyone. I'm Maria Stahl, the Director at the Florida Department of Health in Brevard County. I'll start by giving an update in our COVID cases. To date, we have 38,124 cases. We added 139 cases today. We have a 6.95% positivity rate today. Overall, we have a 13.78 positivity rate. We did add an additional death today to bring us up to 825. Our hospitals and our long-term care facilities are both doing very well. They're stable. They have cases, but they have beds, and they're doing okay. When we look at the pattern over the last 2 weeks, our positivity rate has been 5.6%, 1,332 positive cases. Our median age has dropped a little bit. Our median age is now in the 30s. So we're seeing statewide, nationally, as well as what's happening in Brevard County. Our cases per day has also increased slightly, as well as our positivity rate. Our cases had been running between 75 and 100 cases per day over the last month, the last time we were here, and they're now running between 100 and 150 cases per day. Our positivity rate has gone up by about a percentage point. So we were running more like 5 to 6%. Now we're running closer to 6 to 7% over the last week. When we look at the vaccines given out countywide, we have 184,432 citizens that have received at least one dose of the vaccine. We have 107,533 residents that have completed their series, that are totally complete. Over the age of 65, we now have 69% of our residents that have received at least one dose. Over the age of 60, we have 64%. If we bring it down to those 50 and older, we're at 54%. So we are moving along with everyone in the community's help with the vaccines, getting vaccines in arms of people that want the vaccine. And that's all I have to report today.
All right. Thank you, Maria. We've worked very closely, the county's emergency management offices worked very closely with FDOH throughout the vaccination program. And for an update on how that's going, I'll turn it over to John Scott.
Thanks, Don. Good morning, everyone. Again, my name is John Scott. I'm the Emergency Management Director for Brevard. I'll touch on a couple of things and build off a little bit of what Maria just talked about. Overall, we're seeing some positive trends in the vaccination effort. We're seeing it available in more places. We know that our local, our large hospital systems are providing vaccinations. We know the health department continues to do just an amazing job at their site at the Department of Health here in Vieira. We know that pharmacies are continuing to get support from the federal retail pharmacy program and the state as well. And we're knowing that we see that expanding as the weeks continue to progress. And we know that some private providers, doctors' offices are starting to get some as well. So all of those are positive trends, which means more and more vaccine is coming into the county, which means it's hopefully more accessible to you all. We also realize that we know the demand still outstretches the supply. So we're going to continue to ask you to be patient with us as we get more and more vaccine in there. That's going to continue to sort of be a trend for us for probably a couple more weeks, if not longer, as we work to get more vaccine from the federal government and the state. Again, positive trends in our favor, but we're not done with this by any stretch of the imagination. We continue also to work with community partners to identify our underserved communities, those areas where maybe there are transportation barriers or technology barriers, and try to get vaccine into those areas, again, working in partnership with the Department of Health, the state of Florida, and our other community partners. We can't do that on a large scale yet, simply because we don't have the vaccine supply to do it, but we are trying to make sure that we are getting out as much as we can. We also know that our cities are getting more involved, and we thank those cities that are now offering shots to their residents. And you can go onto our website, which is embrevard.com. You can go on, you click COVID vaccine information, and you'll see not only where to sign up for the Department of Health site, but also for the cities as well. And then the last thing I just want to really emphasize, and you heard Maria talk about, a little bit of increase in cases. I know with the vaccine out there and with it getting more and more readily available, we really want to run towards normalcy. But we've got to be patient and continue to practice our good, sound COVID mitigation measures. So we've got to wear our face coverings. We've got to wash our hands. We've got to socially distance appropriately. And we've got to make sure we're avoiding large crowds so that we get enough vaccine out where people can get their shots and that they're getting their shot when it's available to them. And that's really how we're going to get out of this. But if we decide to let up off the gas a little early, we're going to continue to see trends we don't want to see. So we've got to make sure we're really being vigilant, we're practicing our COVID mitigation measures, and that if you have the opportunity to get the shot, you are doing so. Don?
Thank you, John. The county's response to the COVID-19 pandemic far exceeds putting shots in arms, although we realize that's very important. But we also know that there are residents in our community who are suffering financially, whether it's due to a job loss or fewer hours at work, closed doors, or having trouble making their monthly rent or mortgage. The county has invested a lot of money that we've received from the federal government to get that money out into our community. And we have ongoing programs, and there is one that's extremely important for those of you who need assistance with paying your rent. And I'm going to let Ian Golden talk about the program that's being administered through Housing and Human Services. Ian?
Good morning. Yes, so I'm going to talk about the program. I'll walk you through how to get to the application on the county's website, and I have some data and statistics and some other points that I'd like to make about the CDC eviction moratorium and the eviction process itself. So I think we'll start with the county's website. I think you should be able to see it on your screen. However, from where I'm sitting, I cannot see it. So I'm going to real quick move down to the front. So this is the main county webpage. So when you get to it, you'll see right here at the very top, it shows departments. If you click on that, you'll see Housing and Human Services. You click on it and you get to our department's main webpage. You scroll down and you get to the emergency rental assistance application. You have the option of downloading a PDF version of the application, which you can fill out at your home. You can then drop it off at the county, at our office. You can drop it off at any county library. We have staff who pick up those applications every day. You can email it in. We have an email address. And then you also have the ability, if you continue to go farther down, and that, by the way, Brevard ERA at brevardfl.gov is that email address. You also have the option, if you click on this link, to complete the application entirely online. So the very first page of both the online and the paper application gives you some bullet points about the program. It also gives you some information about income eligibility. So when you look at this chart, the persons in family, that's how many people are in the household who are in the apartment or home that you're renting. And then you look to see if your income falls below either of these numbers. The lower number that says 80%, that's the maximum amount you can earn before you're not eligible for the program any longer. Once you read through this, you click forward. Oh, sorry, I can't see the checkbox. You check off that you've read it. It won't let you actually move forward in the application until you do. And then you get into the actual application itself, which I'm not going to go through entirely with you. I'll just highlight a few things. We want to know because we're required to know to see if you've gotten any assistance anywhere else. So right off the bat, we're going to ask you if you've gotten any assistance from any other source. We're going to ask who has completed this. The actual renter can be the applicant. The landlord can actually apply on someone's behalf as long as the landlord gets a signature on the application from the renter. So they can actually help you fill out the application. We'll then get if it is completed by them, we want some information. We want to know how much you owe. You don't have to owe money to apply to this program. But if you do, we can potentially assist you if you're eligible. We want to know about your household. We want to know all the people in the household, their dates of birth. Everybody who's over 18, we're going to want a copy of a valid ID. That could be a driver's license, that could be a Florida ID card, but it has to have a Brevard County address. The other next set of questions, really, we're trying to just gather demographic information. We will not be reporting on any of this information on an individual basis. We will be looking at aggregate data because we do have to report back to Treasury where the dollars came from. We ask about unemployment. If you're on unemployment benefits or if you are eligible for them, actually puts a priority on your application. So if you can show us, you check it off here and then provide us documentation to show that you're on unemployment, we can actually prioritize an application. If you are employed and maybe have lost hours, you are still eligible because that is an impact from COVID, but we do want to know about your employer. We want to know about the income coming in, again, to back up what you saw on that first cover page about verifying where your income falls. A little bit more, and then we get into what the documents that we ask for as submitting documents, as supporting documents. So hopefully the IRS has extended the deadline, I think, to May 15th for taxes. So hopefully if you've done it, I don't need a bank statements. I don't need your pay stubs from your employer. All I will need is if you've submitted your 2020 taxes, a copy of that submission. That is enough for us to verify income for the year 2020. Like I said, we have valid driver's license information, documentation of that income that you reported farther or back on the application. Again, if there's unemployment benefits. If there is no income for a family member who's over 18, we have a form that they have to fill out that basically says, I have no income and I certify. And then a Social Security waiver, just because we do collect some of the information, just to make you aware. Now, we will need a lease. And one of the things that we ran into when we first opened the program back in mid-February is that we were getting the first page of a lease submitted. We actually need the entire lease with signatures. It has to cover the time period that you're requesting help for. If you owe money to your landlord, they will be able to give you a statement that says this is how much is owed. If you're asking for utility assistance, the same thing. You should have a bill that says that it's past due, and here's the amount that's owed. The landlord or utility company, actually most of the utility companies we probably don't need this for because we have them already, but there's an IRS document called a W-9. The county actually requires that before a check can be cut to the landlord, so we will need that for any of those landlords that are not already in our system. And then on that form, they can use, the landlord can either use a business tax ID number or Social Security waiver. Again, then there are some documents. Again, since this is the online form, you can actually sign the document electronically. And then here's that self-declaration form, Social Security waiver form. Once you get through all this, and again, I'm not going to sign it, but once you get through and hit submit and sign, it will verify that everything's been filled out. So everything that has an asterisk on it has to be filled out, otherwise it'll kick you back and tell you that it's missing. But if everything is fine, it then takes you to the page where you can upload all of those documents that I said that are necessary to be submitted. Obviously, if you're submitting a paper application, you would just attach copies to the application that you submit. Is that?
All right, Ian, thank
So-
you very much.
So, like I said, I do have some statistics. Since mid-February, as of when I checked this morning, we're up to 612 applications. About 30% of those are coming from the unincorporated parts of Brevard County, 70% from municipalities. 395 are still in processing. Part of that is because people will submit applications without complete backup information. And so what we do is we actually give them 5 days to a week to actually provide those documents before we send the application back to them. 84% of the ones that have completed processing have been approved. Of those 84%, we're about $710,000 that's been approved. So that's an average of about $3,900 per application. And there's about 16% that have either been denied or returned. So real quick about evictions. The CDC eviction moratorium was extended to the end of June. Some comments on that. Please use the CDC's form. They have a form that you can go to their website. You need to fill that out. If there are multiple people on your lease, each person should fill one out. Provide that to your landlord. There's some requirements under that lease or that moratorium. You have to have tried to get assistance, so you can be trying to get assistance through our program and check that box. If you're an individual on a lease, you can't make more than $99,000. If you're a household that is filing taxes jointly, you can't make more than $198,000. You have to basically certify that you're unable to pay, but you do also have to attempt to make partial payments. And typically, once you've gotten to the eviction process, you're going to have to make payments into what's known as the court registry. That becomes very important because when you start the eviction process, one of the things that the court will look at is, are you doing as the renter, are you having contact with the court? Have you responded to the eviction summons? Have you put any dollars into the court registry? All of those factor in to whether or not the eviction process continues on. And then real quick about that, please make sure, the eviction starts with that 3-day notice. Please make sure you come and apply as quickly as possible. Make sure you're applying to the court. If you wait too long, we may not be able to do anything to assist. For an example, we received an application Monday night from a gentleman who was seeking help with his rent. He called us Tuesday morning around 8:30 because he had a 9:15 hearing. That's not enough time for us to really step in. You really need to be proactive. If you're behind and you haven't gotten an eviction notice, that's even better to come see us. Gives us a little more time to work with you in case you're missing documents.
All right, Ian, thank you very much for that update. As Ian said, along with those applications being available on the Brevard County website under Housing and Human Services, they're also available at all county libraries. And Ian also said you could bring your application to the Office of Housing and Human Services, and that is at the Brevard County Government Center, which is at 2725 Judge Fran Jamieson Way in Viera, Building B for Housing and Human Services. For an update on some other federal stimulus dollars, I will turn it over to Matt Wallace, our Public Safety Director. Matt.
Good afternoon. Thank you, Don. I'm Matthew Wallace, your favorite Brevard County Director of Public Safety, hopefully your only Director of Public Safety. In addition to the programs that Mr. Golden talked about earlier with rental assistance, there's also a federal program that is going to be coming down within the next month that will be aiding Brevard County citizens as well. The American Rescue Plan, as many of you have probably seen in the media, will start to be implemented what we're seeing probably the first or second week in May. And we should start seeing those federal funds trickle into our county, both at the county and the municipal level. From the county perspective, we are looking approximately about $120 million in total that we would be seeing. They would be entering the county in 2 waves. The first wave would be next month in May, approximately $60 million. And then 1 year later, May of 2022, the second $60 million would be entering the county. There was a little bit of discussion at the commission meeting, if you tuned in last Tuesday, about these funds. There will be more discussion in the future. as we wait on the federal guidelines on how to execute those funds into the community. We hope to see that guidance come in probably a few days before we actually see the funds arrive. So we'll see the guidance. We'll obviously we'll look over it and come to the conclusions and the recommendations, and then provide that out as we see going forward. But again, a lot like Mr. Golden's programs that he just talked about, these programs as well that we see coming in the future are all guided to help Brevard County citizens overcome the ill effects of the COVID-19 pandemic that we've just went through. I'd also like to reiterate what John and Maria were talking about earlier too, that we started talking in these biweekly meetings almost a year ago, Don, quite a long time ago. And I think one of the first things that we advised was this is going to be a marathon. There's going to be a long-term run. And in a marathon, I think it's a lot of miles. I'm more of a 5K guy myself, and I get tired probably after the first K. But in a marathon, I know when you get to about that 23rd, 24th mile, your mind starts going, well, maybe I should just be done. And I don't want to run through the tape, and I don't want to finish because I've traveled this far, and it's been such a long, arduous run to get here. Well, that's kind of where we are. I mean, we're in that 21st, 22nd, 23rd mile, and we need to continue to finish the race and finish strong, but we've still got a ways to go. But the finish line is getting closer and closer and closer. Every week that passes and we get more supply into the county, that finish line gets closer. But we have not finished. So keep it in that marathon mindset. There are times when we will sprint, and there are times when we will just continue to run at a pace. But it's a long journey that we need to continue and that we need to fight through and run through the tape, as my old coaches back in my high school days used to say. Again, I'm a 5K guy. After about my first K, I would start questioning whether I wanted to finish a 5K. So in the same general terms of the marathon there. But again, thank you for tuning in with us. This is all about information sharing. We will get better as a county the more we continue to communicate and get these words out of what we're doing and how we respond to this pandemic. So thank you, Brevard County, for hanging with us. Don, that's all I have.
Thank you, Matt. So as we've done at the end of our biweekly updates, we've had Jesse Ray, our social media specialist, monitoring Facebook for questions. And I understand we have about a handful of questions. So
Yes.
Jesse, fire away.
Sure. So what kind of differences are you seeing in the demographic of vaccination patients with the new expanded age group eligibilities? And how do you feel the supply versus demand issue is currently?
Do you want me to take that one?
Either way.
I was going to say, well, we currently still have a wait list here in Brevard County. So individuals that register on the myvaccine.florida site register, and the older ones should be getting appointments, and the lower age groups that are just registering now obviously get put on the wait list. We are seeing younger individuals from the over 65 population coming through. And what was the other part of that question?
How do you feel about the supply versus demand issue currently?
Oh, the supply versus demand. We are seeing more supply coming into our county, not necessarily to the health department, but to other providers and other pharmacies. The supply is definitely increasing, and from everything we've heard, the supply will continue to increase as the federal government and the state government does get more vaccines. John, do you want to add anything to that?
No, I completely agree, Maria. Like we talked about earlier, like we are seeing an increase in supply, very steady increase. We know we still have a demand, and that we're going to continue to work to meet those two things.
Sure. What trends are you seeing in the case counts of COVID-19? At the last briefing, DOH said there were concerns about the count not dropping.
As I reported out when I did my report, there is a little bit of a concern now. The cases are not stable anymore. The cases are slightly increasing, especially in the last week we've seen an increase. We were seeing about 75 to 100 cases, which was equivalent to where we were about last October, November. Obviously, the big surge after the holidays was really big, but we are seeing a slight uptick right now. We are seeing between 100 and 150 cases per day over the last several days to week, and we are seeing our positivity rate also going up a little bit. So rather than 5 to 6%, we're seeing more 6 to 7%.
Okay. Does Brevard County have any walk-in, no appointment needed vaccine sites?
Not at this time.
Thank you. Is there any information regarding how many people have severe side effects from the vaccines?
The federal government may, but we do not locally.
Gotcha, okay. And kind of along that same vein, do we have any data yet on positive cases after someone has been vaccinated? And if so, how mild is their illness?
We have right now, our epidemiology department is investigating 36 individuals that are classified as potential breakthrough cases. We don't know for sure if they are breakthrough cases, and that's part of the investigation. Out of those 36, there is one that is hospitalized, and that person is over the age of 65.
Okay. Maria, the data that you give us during your update, it only pertains to Brevard County residents, is that correct?
Correct.
So basically, if we have tourists in our area who test positive, that does not reflect in our numbers that you give us, correct?
It goes by county of residence.
Thank you. And I think I only have a couple more. Will any of the new funds be used for food stability?
The new funds, with the rules and regulations, the county, as Matt kind of alluded to, the county commission talked about it this past Tuesday. We're still awaiting guidance from the Department of Treasury. So we're not sure entirely what some of the rules and regulations for those funds are going to be. I expect that once we do get that, the commission will be having further discussion regarding how those funds are going to be spent within those rules and regulations. So food potentially could be a topic of discussion as we move forward.
Excellent. And Dawn, it looks like those are all the questions that I have for today.
All right, thank you very much, Jesse. All right, so as always, we will be back Thursday after next at 11:30 a.m., and we will continue to do these until we feel like we're at a place in Brevard County where the demand for vaccines has waned and the numbers of positive cases has also done likewise. So until then, we will talk to you then. Thank you.